Fracture Clinic is a walk-in clinic where patients who have been diagnosed with a fracture in an outside facility or like an ER, urgent care, as long as they've had a diagnosed fracture confirmed by x-ray, they can walk in during those walk-in times and get treatment for their fracture.
Fracture Clinic was started because we saw a need in the community, as first and foremost. We would see a lot of the children with fractures. Sometimes they hadn't been treated in the best way they could have been treated, and that's not to disparage the providers that we have here. It's just children are different. Their fractures are different. The care that they need is different.
Our referral process for Fracture Clinic is really, really simple. Our patients come from all over the area and are seen in emergency room, urgent care, minor care, with a documented fracture. Providers typically fax us a referral form which has patient information and a diagnosis on it. They're given a patient instruction sheet which tells them what to expect in the next process as far as being seen as a patient in our fracture clinic. There is no appointment necessary, so once they're seen and treated and stabilized in this other facility, then they come with that instruction sheet in the morning hours. We see them in the morning and we get them treated here. When you enter our doors, you'll come up to the third floor here, and you'll see our check-in desks are right behind us. We will check in with our triage nurse, and she looks at the diagnosis, what the injury is, and then puts everything in order based on priority as far as the injury. And then we go through the registration process. When they receive a referral to an orthopedic specialist, it could be, a week to 2 weeks before they even get into that specialist. Here, they get that documented fracture, and they can be seen the very next morning.
You don't have to wait, a ton of hours to be seen. Like if you go to the ER, you just come in here, sign in. We try to move the kids as fast and as smooth as possible. So it's a nice transition for a parent.
I was playing football, and I'm here now because it started hurting, and it's a scaphoid fracture.
To find out last night and be able to come right somewhere right away and then proceed, to get it fixed, it's a blessing.
It's helpful to a family to be able to offer complete care, meaning they can be treated here in the clinic and then expedited for same-day surgery if their type of fracture were to require that type of intervention. It's kind of a benefit of being a clinic within a hospital.
So fractures in anyone, there's a number of different potential treatments. In children, those tend to be different than adults. A lot of the fractures in children don't need surgery. In fact, the vast majority. A lot of the fractures don't even need to be immobilized.
Rylan was doing a tumbling pass at gymnastics and fractured her 5th metatarsal. And so the urgent care referred us here. Brought us up and signed us in and said, yes, it's broken, here's what we need to do, and got her casted up and on her way. I was a little nervous because we had never done Shriners before for her, but I've been highly impressed. They've been very thorough.
We have a good team here. We have a mixture of disciplines. We have medical assistants, we have nurses, we have the surgeons, we have physician assistants, and we work pretty closely with radiology and physical therapy. If the patient were to require like crutches, gait training after being casted, we can work same day to kind of accomplish that, get them educated on how to use those devices.
Rec therapy, who, if we can't calm the kids, so they'll use an iPad, toys, anything to distract them. We also have TVs.
It's kind of nice to be able to offer a distraction if we're needing to put a cast on a child who may not want to cooperate because they're scared, or maybe it's just their age.
Marissa was born with club feet, so she has a stress fracture from walking on it, just a little one.
Right here it hurts, and it hurts one way here and it hurts 2 way here.
We came straight to Shriners for the fracture clinic. Obviously she's seen the Shriners for other things, so we know that this is a good hospital. So we drive an hour and a half from our home just to come here. Everybody here is amazing. The doctors here, knowledgeable. They're great with her. She's not very fond of hospitals. And we just know that when we come here, we're gonna get the best care possible.
I like Shriners because they take care of you and they do good stuff for you, and they always fix your legs and your arms if they get broken.
It's hard to say what my day's gonna be like because it's either feast or famine. Sometimes we're super busy with 10 fractures, 6 fractures, sometimes we have 1. Yeah, we are definitely busy today. It's exciting.